There are a lot of physicians who are really worried about the bleeding risk in patients over 90 years old. And we think a lot of people are undertreated. They don't get the treatment they actually need. So we wanted to know whether there was really a much higher bleeding risk in patients over 90 years compared to patients in their 80s and 70s. So that's why we conducted this study. We included all kinds of patients with all kinds of indications to optimize the generalizability. So there were patients with atrial fibrillation, patients with venous thrombosis, and also with valve problems. And we started to include patients from the age of 70 years. So there are patients in their 70s, 80s, 90s, but also patients above the age of 100 years. There are two kinds of situations. There are people who are just getting older but who are already on an anticoagulant. So those are just the continuing patients, and that's another clinical situation than the Inception cohort. In this Inception cohort there are patients who are newly diagnosed with venous thrombosis or with atrial fibrillation who just start to use anticoagulants. So that's really a high-risk population regarding to bleeds, because the bleeding risk is much higher in the initial part of the vitamin K antagonist treatment. Actually, we were quite reassured, because the bleeding risk was not increased in patients in their 80s and only mildly increased in patients in their 90s. It was like a hazard ratio of 1.26. So we were all afraid that it would be like doubled or 3 times higher in the really old patients, but it seems to be quite okay, I think. So that was our primary finding. And our second finding was that the thrombotic risk was really increased from the age of 80 years. And probably this can partly explained by worse VK control in the elderly population. We think that any age, even above the age of 90 years, should in itself not be a contraindication to use anticoagulants. So we recommend to use anticoagulants in patients of any age, if indicated.